All right, so we're recording and we're going to go ahead and get started. So the first thing why I wanted y'all to get on a little early is that we have our district events coming up, and it has to do with district storytelling. Justin, can you give us just a brief 2-minute summary of what all is involved with this and what we're trying to get from everybody, and then we'll go into some specifics.
Yeah, sure thing. Thank you. And so what we're talking about is our district conference. And so, of course, this past weekend was supposed to be our original district conference. All of that went bananas, just like everything else has. And so instead of canceling district conference, we're spreading it out throughout the entire month of May. And so this past weekend was part one with the student four-way test speech competition, and it went really well. There's a YouTube video of that on the district YouTube channel. And so this coming weekend is the second part, and the second part has two parts to it. The first hour is going to be visioning, kind of strategic planning for the district. And in fact, I can show you a couple of, well, we'll get to that later. I'm not talking about that part. So that's part two. Part three is next weekend, May 16, and that is the storytelling part of the conference, and it's 2 hours long. And so what we're looking for are, hey Christine, are individual Rotary stories. What's your Rotary story kind of thing, and also club Rotary stories. And so what we're going to do at the club level are the things that we've done, not just this past Rotary year, but what we've done as a club. So things like building ramps and polio eradication and pints for polio and pennies for polio and all these other things that we do as a club. And so we want to showcase these kinds of things. And so Ruth has nobly taken on the feat of putting together a little video for us. It's largely going to be kind of a slideshow of pictures. A lot of them, the vast majority, in fact, are already on our Facebook page, luckily. And so it's an easy resource to gather our things, but also short little video clips of what we did at maybe the polio moto thing, or a video clip of bags of love, or at the parade of homes, or things like that. Our student four-way test speech competition, that'll be easy to do because we already have that recorded. And so we're working on assembling all these things, and Ruth has a list. I guess I can dig one up myself to show some things that we have discussed so far. Ruth, I'm not sure how in depth you want me to go yet.
So what I'm going to ask of everybody, because we already have pictures of so many of these events, what I'd like everyone to do is to select. I'll send out the list. So select something that is either near and dear to your heart, or something that you have actively participated in either now or in the past. And then send me a short video clip of you addressing that, just talking about whatever you feel that you would like to share with our other districts. And then you can either text it to me or you can email it to me. And it would need to be in by the end of the week. We're talking about 20 seconds, very simple. And just get it to me, and then I'll do a compilation of everything together. But some of the things that we have on here are, for example, we really want Leo to talk about our spaghetti dinner. Dawn, if you could tell us a quick summary, how we fundraise with the Parade of Homes and the rum tasting. Let's talk about our ramp builds. We want to know how many we've done in the past 3 years. Justin had to point out that Corpus is considered the ramp champs or the ramp kings or something like that, and they have done one a year, and we've done 28 in 3 years. So we would like to kind of reclaim that from them. And so just everything that we're doing on an annual basis, from our student of the month, our four-way test, and everybody giving input to that. That's what the goal of this is. Show what the Kingsville Club, who we are, and what we're doing. That's the gist of it, the summary of it. Do you think I covered everything, Justin?
Yeah, I think so. And so what we're shooting for is roughly 3 to 5 minutes of a little video. And the way the storytelling conference is going to work is we have some folks that are already signed up to give kind of a live presentation over Zoom. And so we're going to have a mix of folks doing it live and then also stuff that's already on YouTube. And so like for our part, then they'll just log into our YouTube channel and then play our video. And so that's the final deliverable is a little video, probably 3 to 5 minutes in length. I assume the vast majority of it's going to be pictures, but then we'll intersperse it with text, kind of explaining what we're doing. And so, a rundown of how much we've given to the Rotary Foundation for Polio Plus, how many ramps we've done in the past several years, how many hours of volunteer work we've given, dollars that we give to the scouts and to, whatever else it is that we do. And so it'll be a mix of media, pictures, videos, text, all sorts of stuff like that. And so that's kind of the grand plan of what we're thinking, and then just breaking down little pieces to the individual folks.
Okay. Do I have any questions about what I'm asking of you, or just any general questions related to this topic? Unmute yourself if you need to ask something.
And Brooke and Dawn especially are really good at posting a lot of these pictures on y'all's own Facebook pages. And so some of that stuff, if I haven't found it yet, the spaghetti pictures or parade of home pictures, Brooke, I already found a bunch of yours. But if any of y'all have really, really good pictures of us doing something, then if you just want to send that hyperlink to me or to Ruth or both, and then that way we can go in and cyber stalk you and then just download your photos and put them into the video.
Okay, thank you so much.
Justin, can I just send you some pictures? I've got pictures of the spaghetti dinner on my phone that I don't think I put up.
Absolutely, absolutely.
Okay.
And you can, you're welcome to email them to me. You can text them to me. You can tie them to a donkey, whatever you have to do. So.
Pigeon, carrier pigeon.
Yep.
Got it.
Make sure it's tasty.
Okie doke.
Thank you.
Thank you. All right, so we're gonna go ahead and get started with our regular meeting. I just wanted to get that announcement out. Our judge is gonna be calling in at 12:20, so we wanna be ready for him when he calls in. So we're gonna go ahead and get started. I don't see Jan here today as our Sergeant of Arms, so I'm gonna ask Idotha Battle if she would please bring us to order with the invocation.
Father God, we thank you for such an awesome day as this, that we can come together, see each other, be concerned about each other. And we thank you for your love, your compassion, and your mercy. And we pray that we will forever be faithful and true to you, God, and to one another. Bring us to your saving grace in all that we say and do. And we ask these blessings humbly in Jesus' name. Amen.
Amen.
Thank you, Idotha. Dawn, can you please lead us in the pledge, please? I'm going to share our screen here. All right.
Am I off mute? Yep. All
All right,
right.
ready when you are.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And Brooke, will you please unmute yourself and get us started with the Rotary song?
R-O-T-A-R-Y, that's spelled Rotary. R-O-T-A-R-Y, it's known on land and sea.
From north
to south,
from east
to west, he profits most who serves the best. R-O-T-A-R-Y, that's spelled Rotary.
Yay!
Thank you. Appreciate it. Okay. Let's see here. We're still suspending our scholarship raffle, but we are looking at ways to bring that back, either through Square or some other form. If anybody has any ideas, please join our board meeting and give us some input, we're happy to do that. And we're going to go ahead and do our Paul Harris weekly drawing for the week. Brenda, I'm going to spin the wheel. Let me know if we come across somebody who is already on there. Here we go. Brooke Spitzer. All right, and the second one is, look at JD, he's looking so close at that screen. Justin Jones. Okay, so they'll be entered into our quarterly drawing, and we'll be doing this weekly. You don't have to be present to win, but we surely love to see your face, so we hope that you are here. Okay, let's go on to the next part of business. We have some Rotary birthdays. The first one is Susan Ivy, who celebrated on May 1st, so happy birthday. We have Steve Roach on May 2nd, Maria Martinez and Mark Walsh on May 4th. So 4 Rotary birthdays we're celebrating this week. Happy birthday to you all. I won't sing to you because I can't be disguised by everybody else's voices, but we wish you a very, very happy birthday. Maybe today, it being both a Taco Tuesday and Cinco de Mayo, you can get an extra margarita. Okay, our Rotary anniversaries, we have 2. Leo Alarcon is celebrating 15 years in Rotary, and Mark Walsh is celebrating 21 years. Mark, do you want to say a few things about your 21 years and how you've come to meet weekly at lunch to meet virtually?
Can you hear me?
We can hear you.
Good. Got a little frog in the throat sometimes, but it's been a wonderful experience. I was thinking of some of the international things that we've gotten into over the years too. And of course, that was part of my job and my scope at the university, is to work with international. So it worked good for me because I was able to do 2 things I wanted to do for the same effort. So multiple results from one effort. So, and it's hard to believe it's been 21 years. So I'm looking forward to another 21.
we hope it's 21 and more. Well, thank you. Thank you so much for sharing, and we're so happy that you're a part of our club and that we have your knowledge and your resources for when we need it, either international or just otherwise.
Well, thank you very much. Appreciate it. Bye.
Okay. Let's see what else other announcements we have. You may have seen in your emails or on our site that we have a really big birthday coming up. On May 26th, we're going to be, Rotary, our club, is going to be celebrating 97 years. Is that right, JD? 97 years. So what we've decided is we will go dark that day because we would like to have an evening social event. It will be both a membership mixer, a social, a celebration of birthday, and a trivia night. And so we're going to be doing, we'll break out into teams, and we're going to be doing some movie trivia. So we're hoping everybody will sign on for that. It'll be May 26th at 6 p.m. And we're inviting Sunrise, we're inviting you to bring an extra guest. So if your friends and family want to participate on a team, that's welcome as well. It'll be a free for all. Okay. Jadine, is our guest speaker on yet?
Let's take a look. Let me unmute. Let's see. Judge, do we have you on here, Rudy?
Yes, sir. Yes, sir. I apologize. My Zoom wasn't cooperating, so I went ahead and logged on via the phone.
No, you're perfect. Hang on. We're going to introduce you properly.
Okay, partner.
All right, Jadine, go ahead. Take it away. We're at 12:20.
All right, thank you very much. Hey, everybody, thanks for joining. Our guest today is going to be Judge Rudy Madrid. And at the bottom of your screen, you're going to see a little box that says chat. So as I'm talking to the judge and he's giving us some information about COVID-19 and the county's response, ask those questions, and I'll be sure to make sure he answers them for us as well. And so with that, let me make sure everybody knows, since mid-March, Kleberg County has been under some sort of various emergency orders. And it's been due to try to slow the spread like the rest of the country. And with that, it's time, I think, to kind of understand where we stand and where we're going and what's the kind of the thought process with our local leaders. And we brought our county judge, Rudy Madrid. Rudy, good afternoon. Thanks for coming. And would you please introduce yourself or say hi to folks and kind of tell us how we got here?
Okay, JD, and thank you. Again, thank you all for inviting me to speak to you this afternoon. I think these types of discussions are important. We've been doing them a lot for the last 6 weeks with different organizations, so I appreciate the opportunity. It's been a long 6 weeks to say the least. Actually, I think we're pushing on 7 weeks now. It's been a long 7 weeks. I'm going to kind of give you a little history of how it started, at least on the Kleberg County side, and kind of tell you what's been going on behind the scenes and where we're at now and what our goals are going forward here. And by all means, if there's any questions at any time, don't hesitate to chime in, and I'll try to answer anything you guys got for me. So I roughly around March 16th is, Kleberg County had already identified myself, the city manager, Tomas Sanchez, our emergency manager. We had already identified, that COVID-19 was a huge concern nationwide. So we started tracking it early on, and in March. Towards mid-March is when things started touching home a little bit more here in the United States. We initially jumped on board. We became very proactive. One of my biggest concerns was having a testing facility here in Kleberg County. We and for those of you who don't know, as your county judge, I have about 25 years of experience in healthcare as an advanced ER trauma nurse provider. And so I knew the importance of getting involved in this very early, and I wanted to be as proactive as possible. Here recently, one thing to our advantage, here recently, both the Kleberg County and the city of Kingsville, we worked very hard together to, for a lot of you that already know, to obtain a grant to restore the J.K. Northway Coliseum. That grant was obtained through the EDA, and what made us very attractable to get that grant, because it was very competitive, was that we were deemed a regional emergency operations center. I was part of the governor's task force team right after Hurricane Harvey hit, so we were there at ground zero, monitoring all the different communities that got devastated through Hurricane Harvey. So when these types of grants became available, the key word was resiliency against natural disasters. So we went on that aspect saying, hey, listen, no different than our FEMA domes that we're going to be a cafeteria or a school gymnasium during daytime, but they're a FEMA dome during natural disaster. I went with that same concept on the JK Northway. Hey, it'll be a multi-complex entertainment center. We actually added in a couple other variables where we're going to create a regional law, fire, and rescue training facility, because we're going to put some classrooms in and around there. And we're going to be an emergency operation center, a regional emergency operations center. And this was a way to obtain those funds desperately needed to restore the JK Northway and to provide an even better service in the event of natural disaster. At the time, we were never thinking a pandemic. We were thinking hurricanes, of course. But nevertheless, we won that grant. And we were able to do that because we told them when we fought for these grants at the federal and state level, I was able to tell them, hey, listen, as county judge, you're the emergency manager, and you think you got all your ducks in a row. You put your folks in shelters, you do sandbags, you help your senior citizens get transportation to safe places. We have identified population risk groups that are higher risk than others. So we get all our ducks in a row. We wait for the hurricane to hit. And when the hurricane's gone, we wait for the cavalry. And, oh, by the way, we found out there's no cavalry. The cavalry is what you make of it. So we told the state and federal leaders, hey, we want to be that cavalry. We want to have a regional emergency operations center where we can have an official FEMA staging ground, AgriLife, the state forestry department, you name it, law, fire, rescue. We'll have a big staging facility. So we have a safe area to pre-stage. The hurricane comes through. When it's gone, we have everything here needed to suffice so we don't have to rely on state and federal assistance immediately. And oh, by the way, if the hurricane dodges us to the north, to the south, to the east, or the west, well, we're standing by ready to assist. We'll be that cavalry ready to help our neighbors, Brooks, Hebronville, Kennedy, Willacy, Jim Wells. And so that was the concept. And again, we won that grant. And that weighed heavily. And we didn't realize that we were going to get hit with the pandemic. When we got hit with that pandemic, I went back to Austin and I said, hey, listen, look, we're deemed, although, we hadn't started construction on, we just got we were just awarded the grants. We hadn't started construction on the Emergency Operations Center. I said, we're still deemed a Regional Emergency Operations Center. I said, with that said, there's a lot of folks in South Texas that are going to be affected, and we have nowhere to go. And I know that for a fact because I had reached out to Judge Barbara Canales in Nueces County. I said, listen, can my residents in Kleberg County go to Nueces and use your testing facility? Because that was the only one in our area. And they had just acquired it. And she said, yes, you have our blessing. But the minute we sent our first 2 patients there, they got turned away. And there was a lot of logistics behind the scene that went on. And so Judge Barbara Canales didn't realize that she did not have the authority to say that they could. So that became an issue right off the get-go. So we did a needs-based assessment right off the get-go and said, okay, what do we need? What are our priorities here in Kleberg County? So my biggest priority right off the get-go was we need a testing facility. There was not enough PPE in Kingsville, in the state of Texas, well, in the nation for that matter. And it put our healthcare providers at risk. And I told them, I said, listen, our emergency room and the few healthcare physician offices that we have here, we cater to all the surrounding areas. I mean, Hebronville, Falfurrias, and Kennedy, portions of Willacy. I said, these are all our neighbors that are coming to us, and not just for COVID-19 stuff, but for your everyday stuff. You go to the emergency room any time of the day, you've got heart attacks, you've got strokes, you've got pneumonia, and all the other illnesses that go along with the emergency room. I said, if our emergency room staff or these local physicians' offices get infected because they're underprepared, they don't have the PPE right now, I said, we're going to be sitting ducks. I said, we need an alternative spot, a remote spot where we can send these patients that are getting treated for the corona, that are getting screened. We need to keep them out of our emergency room and keep them out of our local doctor's offices. So that was the big fight I put up. We gave them a good fight, and we were awarded it. And we were able to do that because we had that status. We had that regional operation status given to us. So that was a
Judge,
huge,
let me ask you about that.
Yes, sir. Yes, sir.
Because we were granted that status and the hard work that the county put in for that, and you being on the forefront of that, Rotary just provided lunch for a whole gaggle of folks from the Texas National Guard this last weekend. What were they doing there at that site?
So we had, again, we've been providing that testing facility for the last 7 weeks. However, that testing facility is dictated, managed, run, operated by the what's called the Region 11 State Health Department. Okay, falls under a physician called Dr. Pro, and she is the one who has the ultimate authority on who gets screened. So one of the criticisms we were getting in Kleberg County was that, hey, they're not screening everybody, and the reason behind that, and we tried to educate. Janine Reyes has been a huge partner of mine since day one. She's been the driving force behind effective communication on social media, on the news press. So our job that we were challenged was we needed to educate folks, and we need to let them know that, hey, listen, this is a screening facility. There is a rigorous screening process that you're going to go through. And if you meet those guidelines, then you're going to get tested. If you don't meet those guidelines, you're still equally important because they've identified you now. They're going to send you home. They're going to quarantine you, and they're going to continue to monitor you. And if you all of a sudden acquire those extra symptoms that you lacked, now they're going to test you. But either way, they met their objectives because they tested you. But there was such a shortage on testing that they weren't going to just test anybody. They were going to test only the absolute folks that met 100% of the symptoms. That became an issue because, of course, you have concerned citizens that say, hey, listen, I want to get tested too. And you have the underserved folks that don't have the money to go to a private physician and get tested. With that said, with that said, I found out that the governor's office was going to put up some of these mass screening facilities, okay? And we weren't on that list. Matter of fact, the only ones that were on the list initially were Harris County and Huntsville. And I was really excited. I don't know if you saw the governor's speech when he started issuing his new orders and started releasing a lot of these non-essential businesses. But if you noticed in there, he mentioned Kingsville, Texas. He says, at this moment, he goes, we are going to allow it in Harris County, Huntsville, and Kingsville, Texas. And that was a huge victory for us. And again, it was because we were deemed that regional operation site. And because I said to them, I said, listen, if you're going to do that, well, we have a lot of folks and we got a lot of underserved folks that can't pay for it. And we just have a lot of citizens in and around our community that still come to our community to go to Walmart. They go to HEB here. They go to our doctor's offices. So, in my mind, we have a sense of responsibility to test these folks because they're coming to our parks. Some of them go to our schools. And so I wanted to be able to provide a mass testing facility. And let me tell you, it was a huge victory, I think, for Kleberg County. We teamed up with the Texas State military, with the National Guard, with the DPS, the Sheriff's Office, the Kingsville Police Department, the City of Kingsville. It was a huge state effort, and it was very successful. Since that, they've expanded it to other counties now as well. And not only that, but they're asking if we would like to have them back in a few weeks, which of course I'll do it, and again, this was an effort to capture as many folks as we could. I wanted to get that extra security blanket for Kleberg County personally, because if the governor is going to be reducing his restrictions and opening up a lot of these businesses, and I'm not afraid to tell you, I wasn't 100% comfortable with that yet. I think that
Judge, let me hold you off on that, because I definitely want to get to that, because I'm getting a lot of questions about it. But let's stay real quick. Let me wrap up with one of the things that we did successful was having that testing site and coordinating with the National Guard and the governor's office. With those people at the private lab, I want to make sure, do those numbers, how do they get to you? If somebody goes to a private lab and they're screened and they do come positive, do you have access to those numbers?
Yeah, so I speak every single morning for the last 7 weeks. I speak to a doctor by the name of Dr. Pro. She's located in the Valley. She's the executive director for Region 11, who's our governing state health department. Okay, every single positive test that comes through Kleberg County immediately gets reported to her. She runs this area, so she has direct communications with every county judge in our region. With me, we speak every morning at 10 a.m. and every afternoon at 5 p.m. We get updates. Whether the update is staying the same or not, we have a running agreement. We speak, and she'll say, "Judge, nothing's changed. Talk to you tomorrow." But if we get a positive case at 10 o'clock in the morning, she's going to call me at 10 a.m. anyway. So she's been a valuable asset to our team. Again, we have a working relationship. We work hand in hand. Although I've never met her in person, I just over the phone. I've never seen her, but we have a good working relationship. We have in Kleberg County, we have a team that we put together, a professional oversight team consisting of myself, Janine Reyes, the city manager, the mayor, Ben Gonzalez, Francis Garcia, my chief of staff, and Commissioner Schultz, and he oversees it. So the minute Dr. Pro notifies me, I notify the team. We put together our and again, Janine and Ben Gonzalez, they run the media for us, our websites. So we coordinate, we get the facts, all the pertinent facts that are given to us. We put the press release together. Janine coordinates that press release. We all approve it, and then it gets fired off at the same time on both the city and the county site, because we never ever want them to say, hey, they didn't receive information. Never want them to say there was information withheld. I can tell you, Janine and Ben have done an amazing job at. I mean, by the time I tell them, within 10 minutes, Janine has a press release ready to blast out. You know, the mayor and myself, we look at it, we give the thumbs up, and it's out the door. You know, so these tests that were just done at the remote site.
And we're lucky here in Kleberg County to have, or at least Kingsville Rotary to have Janine. She's a member, and she's been fielding a lot of those questions for us too. But one of the things, and thanks for telling us about that. So it sounds like Dr. Pro gets everything reported, period, from our region. I
was going to add to that, no matter who does the testing, because you got to remember, up until now, we haven't had any come through our testing site that's been positive. Believe it or not, all the positive tests have come through either our local area hospitals or our local clinics. So even their results still have to go directly to Dr. Pro, you know, and
so
as with
everybody that goes through there, are they automatically quarantined?
And so the only exception to that is this weekend, okay? Because this weekend they were going to test you regardless of your symptoms, okay?
Okay.
So if you go through the regional testing facility on any given Thursday, that means you have symptoms. That means you're going to get medically screened right then and there. If you don't meet all the qualifications to get that test, they're going to send you home and they're going to quarantine you. They're going to follow up with you on your daily progression to see how you progress. And between you and I, there's another reason behind that. And these swab tests are incubated tests. And what evidence-based research has shown is that if you take, let's just say I went in for the test and I do have the coronavirus, but it's at the very early stages of it. I'm still in the incubation phase, okay? If I take that test too soon, those tests are known to have false negatives, meaning they'll incubate it for a couple of days. They say, you know what, you're negative, go ahead and quarantine for 14 days, Mr. Madrid, and we'll follow up with you just to see if it's progressed. The fear in giving you that test, aside from the fact that you wasted a test and they're hard to come by, the fear of giving you that test is that Rudy Madrid, after 3 days, might say, well, you know what, I came back negative. Let me run off to HEB real quick. I got to pick up a few things. You know what I mean? And then that incubation thing progresses, that period progresses, and in 10 days from now, I have full-blown coronavirus. You see what I'm saying? So it's to their best interest not to test them. If it's early, if the symptoms are too soon, they're not going to test them. They're not going to waste that swab, and they're not going to give them false hopes where they let their guard down and release them out to the general public. So and that's a method that's approved by the CDC, that's approved by Dr. Pro, and it's being followed by all the remote testing sites in the state of Texas.
Judge, I want to rely on your medical background a little bit. And, you know, I'm sharing my screen with our members right now, and everybody, and just give me a thumbs up if you can see our COVID case tracker from the Health and Human Services. And I'm looking on it, and reported as of yesterday about this time, Kleberg County was up to 10 cases. Now, I lost track. For some reason, I thought we were still around 7. And now that we're at 10, we hear a lot about the scary factors. We hear, of course, we hear about the fatalities, and Texas total fatalities is up on their screen too. Can you tell us, if you're able to, a little bit about some of the people that have pulled through this, maybe the Kingsville, Kleberg people that we haven't heard about, and give us some of those stats?
Yeah, so right now, I'll give you the stats first. Right now, Kingsville remains at 10 positive. As of 10 a.m. this morning, we have 10 cases that were positive. Out of those 10 cases, unfortunately, 1 person has deceased. 5 people have been released from quarantine, and 4 patients are still in active isolation. Okay. Again, what I can tell you is what makes COVID-19 so much more dangerous than the seasonal flu is, one, it's a higher strain flu, which has no vaccine for. With two is a lot more transmissible. It's highly contagious. And three, the folks that, if you're an average healthy adult, the likelihood of you recovering is very, very high. Okay, but the likelihood of you spreading it is even higher. Okay, so you and the ones that we worry about are immunocompromised folks, folks that have preconditioned heart disease, high blood pressure, any type of respiratory disease, and chronic obstructive pulmonary disease, COPD, emphysema, smokers, obesity, folks on chemotherapy, our elderly, our disabled. These are folks that we have a genuine concern for. So we did a need-based assessment, and that was our targeted group. So collectively as a team, we said, listen, we've got to keep our elderly, our seniors, our disabled, we got to keep them at home, if at all possible. Initially, we were being very sensitive. We said, hey, listen, H-E-B, Walmart, please, we're begging you, can you allocate the morning hours only for the seniors so they can get in and out of there on their own? They're not in the general public. They have an easier time getting their groceries. It wasn't good enough for us. It wasn't working the way we wanted it to work, and nor did the county or the city have the authority to order that, to make that order. So with that said, we teamed up with our human services department, volunteers, sponsors. We thank you guys from the bottom of our heart. Believe me, you have no idea how far that $500 goes that you donated. We have done weekly care packages for the seniors. So we already have a targeted group, because we have the Meals on Wheels already in place. We have the Senior Citizens Hall already in place. We know Sister Elizabeth, the Weavers of Love folks. So we have targeted folks, and we have, we have grants at the Human Services that already help us subsidize, like the daily meals for these folks. Okay. There's qualifying factors to get into our program, during this COVID-19, the state issued out waivers so that we could open the doors to all of them. Like, hey, listen, these are, even if you didn't quite meet the criteria, we're not going to say no to anyone. We're going to help anyone that's indigent, disabled, and handicapped, elderly. If you could pick up the care packages and the meals, we have assembly lines every day where they come pick up meals, and we do the care packages once a week. Those that can't pick it up, we're going to deliver it to your doorstep, or deliver you a care package weekly. We want to keep them out of the grocery store, try to keep them going week by week. And I got to tell you, if you haven't been out there, that is an amazing system we got set up.
Judge, let me ask you about that. Rotary just recently donated one of our grants, about $500, for some care packages that I believe were being put together on Thursday. Is that the same program that you're talking about?
Yes, that's the program we put together. We put it together early on in this whole pandemic started. The minute we closed the doors to the Senior Citizens Hall, we said, hey, listen, we've got to have a concentrated target on these individuals, and we've acquired so many more into our pool now, because there's so many more that needed help. And I talked to Janine this morning. The money that you guys donated is going to be put towards the following week care package, because this week we had a generous donation by one of the city commissioners, Edna Lopez, and the sheriff, Richard Kirkpatrick. They donated some meals. So this Thursday they're going to be giving out those they're prepared meals, already prepared meals that they're going to be giving out. Then the following week we'll do another round of care packages. So, and we'd love to have you guys out there. I'll get you all the details with you, Chris. That way, if anyone wants to come out there and help, it's a great day. And
Judge, I have a question.
Yes,
sir.
I'm of course speaking on behalf of all of the cosmetologists and barbers in town. My question is, I'm sure like when they allow us to reopen, that we're gonna have certain things that we can and cannot do. Do you know if there'll be a list provided for every barbershop or salon facility in town that we can get like off of the internet or something, so that way we'll know which route would be better for us?
Oh yeah, yeah, definitely. Matter of fact, we made sure that all the restaurants, like, 'cause the governor divided it into phases, phase 1 and phase 2. So phase 1 was the restaurants and stuff. So we made sure that we even, the city manager and Janine Reyes even condensed it, because it was such a lengthy order that he put out. They just took out bullet points that pertain to our businesses. So a restaurant owner knew that, hey, this is the amount of capacity you could have. This is how far apart they had to be. They had to have like paper disposable menus, and we just made it real user friendly. And then we opened our doors. We said, hey, if you want us to come to your restaurant, we'll even we've got Emilio Garcia, who's a huge asset to us, our health director. So look, we'll go up there and we'll tell you exactly what you need to do to be in compliance. And if you need some help with that, we'll even help you do it. Right before the order issued, the order to exclude the barbers and the salons, we both the city manager and myself, we made a real honest attempt to keep y'all open, because in our mind we felt that fell under hygiene, So we were telling them, hey, listen, if you're doing an appointment based, that's cool. If they're waiting out in their car, until their appointment, great. Wear a mask, perfect. But then we got overruled when the governor issued the order. Then it was out of our hands. So, but by all means, the minute they lift that order, we'll come out to your house and call us, and we'll even show you exactly what the expectations are. We're here to help. Believe me, nobody wants our businesses open more than we do. We just want to make sure that it's done safe, so we can keep everybody safe. What we don't want to do is just do it carelessly and then take back steps, so that all the work that everyone's done, backfires on us, and we're back at square zero again, And this has been a huge burden on our children, our educators, our businesses, our county government, our city government. It's put a huge strain on everyone. And so we want to make absolutely sure that we're doing what's in the absolute best interest of our community. Get everybody safe, get this COVID out of our community, so we can get back to work again, and then make them think about it.
Are you able to, do you speak with the governor? What kind of communication does his office have with you on how he's about to proceed?
Well, I speak to the governor's office, to his staff, and of course to Jim Lozano. Right now we're in the evaluation phase. So here in the next 10 days, they're going to see how effective it is. Right now, I'm trying to remain optimistic. We haven't had another positive case in the last couple of days, so I'm worried a little bit about this, the results coming back from this weekend. But I'm going to try to remain optimistic, and if we can see the downward trend start hitting, then the governor's going to feel a lot safer. He has telecons with the county judges, where he gives us updates across the state of Texas. This is the evaluation phase, and the mayor hit it right on the head of the nail last week during our press release, when he said, listen, the governor's office is seeing how well Texans respond to this. They're lessening the restrictions. They want to make sure that folks aren't heading out, and taking off their mask, and hey, life is back to normal again. As long as people continue to heed the warnings. And I'm going to be honest with you, this is what I foresee, when not only once the governor opens up everything, I'm going to still continue to encourage everyone to take the same precautions for months, because he's expecting a second wave come the fall, So whereas we've always been trying to prepare for hurricanes, well, now we've got a different type of emergency management in our Rolodex. Now we're going to be preparing for our second wave of a pandemic, and that includes
that weekend information to be published, that testing from this weekend.
Janine, I think we talked about it yesterday. I want to say like the 14th or 15th. Don't quote me on it, but it's in that time frame. And May 14th
she's
or 15th.
on the line, Judge. We can get that answer from her real quick.
Well,
okay.
They told us out there just that, you know, they were saying 24 to 36 hours. We know that they told individuals up to 90 hours. And I'll tell
No,
you,
Jenny,
two people that
Jenny, we're
tested.
talking about the mayor's when he's supposed to reevaluate for phase 2 is what we're talking about.
I thought you were talking about the results from this weekend.
Yeah, no, we're talking about. I think the governor's team was looking at like the weekend of the 14th, or was that correct, or was it the 8th?
The 18th for phase 2. They were saying.
18th. Okay.
Yeah.
Okay.
So.
And let me ask for this weekend, when do you expect those results to be back? The testing from this weekend?
Yeah, well, I think they gave us a blanket of 96 hours. I don't think it'll take 96 hours. I think they said 96 hours just so that if they don't come back in 36 or 48 hours, they're not getting a lot of gripes like, hey, they said 36 hours, 48 hours. So they said 96 hours, so that's what we're going to go with. I know they sent them. They had a pretty neat setup. They, you know, believe it or not, at the end of the day, so the way this remote testing facility worked, it was strategically run, and you had staging areas where the cars had to wait. Then they pulled up to the drive-through. They were not allowed to get out of the cars. They tested them in the cars. At the end of the day, the game wardens, because this was state-driven, the game wardens would pick up the specimens. They took the specimens to Corpus. The highway patrol, DPS, had their private planes that flew them to Galveston, and they're at UTMB Galveston getting tested as we speak. When UTMB gets the results, they send the results to Dr. Pro in the Valley, and she contacts county judge and gives them updates. So they've
Yeah. Oh,
yes, sir.
I want to cover that here when we wrap up in just a second, but I do want to touch one of the things that I know you've been concerned about, and one of the things that I don't think a lot of people think about. I'm now sharing our screen, and I'm going to show everybody the response rate for our census. One of the things that, you know, may affect us in the long term is the 2020 census appears is happening right now in our in our country, and Kleberg County traditionally is about 60% underreported. That's where it lasts us for the long term. That's where a lot of our grants, that's where our representatives, that's where all that information that affects companies that move here come from. Have you been thinking about that?
Well, I tell you, I'm glad you mentioned it, because you must be listening in on my phone calls from your office to mine, JD. I tell you what, I've been working on the census with the census crew for about a year now, because remember the prior census happened way before I retired from the Navy, before I came back home, you know. So I got real savvy on it. I got educated on the census and how important it was. So we got really organized, and you know, we had just started, you know, prior to the pandemic, we were doing twice a week. We set up at the public library. We set up at my veterans office. There was at the courthouse. We were doing recruitment efforts, mass recruitment efforts to get folks hired on, and these are good paying jobs, like $18 an hour. We were recruiting all these folks to come. We're teaming up with the city of Kingsville, and you know, we've got Veronica here, who I appointed as our chair for Kleberg, and we were going to have a huge, well, we're still going to, a huge strategic approach going into this round of census. And I really wanted to blow this one out of the water and just have a huge, massive city and county effort. And then, you know, along comes this pandemic and everyone forgets about the census. And we were just talking about this with my commissioners. I said, we've got to really hit the ground running now, because, you know, remember, these guys should have been knocking on doors a month ago. We were supposed to start in last month, and it was right in the middle of the, you know, our timeline was to start the knocking on doors and hitting everyone, and it happened right at the middle of the pandemic. So we're going to really, really have to regroup and hit it hard, and not only us, you know, everyone else is going to face that same issue we are. But on a personal level, you know, I've always looked at things that Kleberg County has done in the past that we can improve on, and I love that's low-hanging fruit for me. I love to be able to say, hey, look, I came and man, we fixed that problem. Well, now the problem got even bigger because we got a pandemic during the middle of this one. So we got our work cut out for us. But nevertheless, so we're going to focus on it. We're going to work really hard.
Well, we've got a lot of leaders of our community and employers on the line, Judge, and we're looking at almost 40% report rate. So we've got a lot of work to do. So I'm going to look for our members to help us with that.
Any help we can get, church leaders, school leaders, business owners, any help we can get. This is going to take a community effort, and that's how we're going to sell it. And I really am. I'm going to tell the entire community, and that's going to be our media approach. Is that, hey, listen, we're putting this in your hands. This helps me. I'm like the town peasant. I go back and forth to Austin. So much now, my car could go like in cruise control, going back and forth. If I got the numbers, that only helps me because I go after every single dollar I could ever get, both on the federal side and the state side. And when those numbers are get greater, that makes my job so much easier, and it helps me justify some of the things that we try to get accomplished here in Kleberg County. We're gonna pull Jerry Maguire, like, help me, help you. Let's get these numbers out there.
Well,
and there's a lot of.
Let me ask you this, Judge. I know you've been at the health center this morning, and as soon as you hang up there, you're going to be back at it. But let me wrap up very briefly with what should Kleberg County residents be doing, and what do you expect us to be doing by next week? In your thoughts?
Well, what I put out a plea to the community this past week, and I told them, listen, I knew early on the county did not have the authority. I know there's other counties that did it, but I can tell you it was done illegally. The county does not have the authority to mandate people to wear masks. You just don't have that authority. It's become such an issue in the state of Texas that the governor had to add it to his language to remind county judges, you don't have that authority. Okay. I tell folks, listen, I want our businesses to get open. I want our folks to get back to work. I want our children to get back to school. And believe me, I want them more than anybody in this community. I want them to go to church. I want to go to confession. And I want to do everything we're supposed to be doing. But I want to do it the right way. And all I can plead to our citizens, listen, work with me on this. I wouldn't steer you in the wrong direction. Practice social distancing. Stay at home when you can. Keep your kids at home. Your kids have no business in the movies right now. Our educators didn't let them out so they can go to the malls and the movies. No, keep them at home. Keep them safe. Keep your grandparents and your parents at home. Do their shopping for them. Utilize them. Community resources, if at all possible. Do everything we can to keep this virus contained, at the same time allowing these folks to go out there and work safely and earn a living and get their businesses open again. Support your local businesses at all possible. If they're having to do delivery and curbside, support them, and get them back on their feet. This is our community. We've got to work together as a community. And I'm going to tell you, I'm very impressed. I've never been so happy to be your Kleberg County judge as I have been during this pandemic. I have never seen the city work so well with the county, and like I've seen in these last 7 weeks. Our volunteers, our sponsors, our donors like you guys, and it reminds me of Afghanistan. When I left during 9/11, when I got deployed, we were devastated and I was heartbroken. When I came back, I saw American flags in every house that I passed. I saw signs, everything was about the troops. And that's what it reminds me of a nation coming together when we're at our weakest. And when we're at our weakest,
where do you think we'll be next week?
Well, I think that I'm hoping that our numbers will start declining. We'll see. My day-to-day operation is not going to change. Janine's not going to change. We're going to report to you every single day. The minute we get news, the community will get news. I think that our businesses will start getting, and again, it's totally up to them, the ones that feel comfortable opening up. I think once we can show them that we're starting to tackle this virus, I think some more doors will start opening. I think I think our barbers and our cosmetologists, I think they deserve to get their doors open pretty soon. There's a safe way of doing that, and I think they'll all comply. I think people are going to start getting back into church slowly. I talked to a lot of the church leaders, and they've got the plan down. You know, they know what the governor's expectations are and what's safe and what's not. You know, I think next week I'm hoping we can have some safe graduations. I really want to be a part of making that happen. I'm working with the school leaders in both Rivera Academy and KSD to make that happen safely. You know, parade style graduations where maybe the parents can stay in the cars after the parade. We can spread out the kiddos and have them walk across stage one at a time with a mask on. You know, those kids just put a bunch of years of education in there. We've got to honor our children somehow, you know.
We all look forward to it. We've got some educators on our call, and so we'll keep our fingers crossed. Judge, thank you so much for coming to speak with us and give us a little bit of insight on what it's going to look like, and get back to work.
Yes, sir. Yes, sir. God bless. Y'all take care. Stay safe.
Thank you. Bye-bye.
Okay.
Thanks, Judge.
Bye-bye.
Thank you, Ruth.
Thank you. I think we got a lot of good information from that call. It's one of our best speakers, I think, during this time, including Janine's program. That was great as well. We're going to continue to bring programs like this to you so that you can be informed in what's going on both locally and statewide. We were able to hear from international groups that we've worked with. So the platform that we're using now has really opened the doors to things we hadn't really considered for programs. So if you have a suggestion for one, please let Claudia or myself know. We are looking to book some additional ones in the next couple of weeks. So we are open to some suggestions. With that being said, I'm going to go ahead. We're 1 past 1, so I'm going to go ahead and close it out with the 4-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? I will leave this chat open for the next 15 to 20 minutes. If anybody wants to stay on and have any conversations, you're more than welcome. If not, it was great seeing you, and we will see you again next week, Tuesday, the same time. Bye.
Take care, everyone.
Thanks,
Bye.